I just got my second hair transplant procedure, and since this is something that hasn't always been discussed openly, I've documented the entire process to answer commonly asked questions like, does it hurt and does it work? Both men and women can experience thinning or loss of hair, and it can be extremely embarrassing and even depressing to go through. My hair started thinning when I was 23, and by 25, I thought I was gonna be bald before I was 30. I now have a full head of hair. My first transplant of 1,300 grafts was with Utah Facial Plastics in 2022, and it went so well that I decided to get another one. The first step in the process is to meet with a hair restoration specialist for a consultation. I chose Utah Facial Plastics for both of my transplants and couldn't be more satisfied with my experience. During the consultation, they'll discuss both surgical and non-surgical hair restoration options. If surgery is the route you decide to go like I did, you'll determine if the FUE or FUT method is a better fit for you, meaning the strip or punch method. Based on the thickness of your hair and your desired outcome, they'll then decide how many grafts will be ideal. During the pre-op, you'll get all the information that you need to be prepared for the day of surgery. Let's say this represents the back of a human head. The surgeon will start by making sites in the areas where the patient wants more hair to grow. Then hair will be extracted from the places where it grows the thickest, typically the back of the head. The surgeon will use a tool to extract each hair follicle one by one from the back of the head. Then the hair in the follicle will be transplanted into one of those sites that was made. A week before my surgery, I ended up visiting my grandma in the UK after she had a stroke.
Close up.
But now it's the day before my surgery, so I'm quickly flying home to get a haircut.
And you want it up to like or up?
All the way up. You can't see the scars yet?
If that's a scar, they did an amazing job. If you didn't tell me I'm looking for little white spots, I don't even know there was nothing there. Ta-da!
All ready for surgery. It's 4 in the morning and I'm about to have a hair transplant. They're gonna thicken up this middle area. On my way for round 2.
Are you nervous?
But not as nervous as last time because now I know what to expect. The morning of the big day, you'll be asked to eat a big breakfast, which helps pull all the blood away from my head and into my stomach so that I don't bleed as much as I did last time. Just in time to enjoy the sunrise. Are you excited to film your first hair transplant surgery?
Yes.
What are you most nervous about?
Seeing the blood and messing something up with the camera.
You'll be fine. Good morning.
Hey!
Hi, how's it going?
Good, how are you?
Good.
Alright, Matt. Come on back. Ready for today?
Upon arrival, your surgeon may make some final markings on your scalp and take some pictures before escorting you to the operating room. How's it going?
Good. How are you? I was just looking, it's been like 2 years since we did the first one. Almost 2 years.
Yeah, almost exactly 2 years.
We've got a nice uneven hairline, which is what we want. We don't want a straight line. So I'm going to kind of mark that according to what we did before and then just follow that as we fill in today. You did your own haircut, which is awesome. So we'll be able to harvest here. This all healed up really well.
Alrighty, game time. Let's do it.
They'll begin the procedure by checking your blood pressure, vitals, and then numbing the scalp. Alright.
Leave them intact.
Yeah, I think I destroyed the last one.
So we're in here in our procedure room, our transplant room, and we've got our whole hair team here, Julie, Jillian, and Mel. And they're our in-house team, so they are here working with us every single day. I'm gonna kind of do what's called a ring block, so I'm gonna put injections all around this area where we're going to be doing the hair. So you should be starting to feel kind of numb along this line here. Once we get the front line, then I can kind of go around the periphery, and usually those aren't quite as sensitive, and you're doing really well. We want mostly singles in the front because that's sort of the natural hair, and single means one hair coming out of the follicle. A follicle is a root of hair. A follicle can have 1, 2, 3, 4, or even sometimes 5 hairs coming out of that one root. And we like multiples because they make it look thicker. We count by grafts, which is a follicle. We don't count by hairs. So if we tell you you're doing 1,200 hairs, that's not the same as doing 1,200 follicles. We're doing 1,200 grafts or 1,200 follicles, which is probably about double that amount of hairs.
Once everything's numb, the doctor will begin making sites that the hair follicles will be implanted into.
Right now, I'm making sites with a small needle. All of those little bleeding spots, a site has been made there, and I count them by hundreds and mark them off here. When I get 100, I mark it, and then I know when I get up to 1,200. The bleeding is good for survival of the graft. graft, it just makes our job hard because we can't see as well if there's a lot of blood in the field. We want the bleeding, we want the blood supply, but maybe after we get the hairs in.
I used to work with a guy when I did door-to-door sales, and he used to always walk up to me and say, "You look like a bleeder."
Really?
I think he wanted to punch me in the face.
It's a very strange thing to say to someone. Everything's going great. A little bit oozy, it just is what it is. It's just something, you know, we have to deal with. It's nothing you did or didn't do on your end. You did everything you were supposed to, but sometimes people just bleed a little bit more than others, and your salesman friend was right.
You were right, Brad. I'm a bleeder.
As soon as I'm done here in a few minutes, then I'm going to turn them over to Julie. Switch positions and we'll go to the back and start removing the hair. It's kind of finishing up here. You can kind of see the little marks, they kind of bleed a little bit. All of these are just scattered throughout the hair, kind of from here back to this kind of mid portion. We're pretty much there. I'm going to just do some more. We'll give you a little break, maybe have them take a little snack.
Yeah, that was way faster than I remember. That's a good snack drawer. Let's have the camera take a look at them. They just finished making 1,200 sites for the grafts to go into, and now they're going to pull the hair out of the back. Okay.
You got your little guy?
I do.
Okay, how's that feel?
That's fine.
Pain or pressure? Yeah, and then we just have to pull him out individually.
Mel and Julie on each side of the back of his head, pulling out these little grafts that have been punched out. And we just gently grab those and tug them to pull them out. All the grafts have been processed under the microscope.
Each hair follicle will be carefully counted and inspected to ensure it can be placed successfully.
And this is what it looks like when we just pull them off the scalp, and then we'll trim them up, count them, and then separate them from like singles to doubles.
And these are grafts now that have been prepared. They have a little hair coming out and they have a root underneath.
Then the process of implanting the hairs into the top of the scalp begins, and how long this will take depends on how many grafts you request.
Now we're on to the final phase of the procedure, which is what we call placement. Julie and Jillian are placing these grafts, and Julie's got a lot of grafts just sitting right here on her finger, and then she's just taking them one at a time and placing them into these little sites that I created earlier.
This is the most relaxing part of the procedure. For me, not for them. In this case, I did 1,200 grafts, so the procedure took just under 6 hours, and that was with me taking a lot of breaks and chatting with the doctors.
Mel's got one more.
That's the last one?
Yes, sir.
Well, look at that. Wow. Once all of the hair follicles are implanted successfully on the top of the scalp in the desired areas, the doctor will do a final review to ensure the grafts look acceptable and then give you follow-up instructions.
This is really good back here. I kind of focused most of it right through here. Can you see all those little white areas that are just kind of poking up through the skin?
Yeah.
Those are all the grafts. So how was it overall?
Yeah, it looks awesome. Easier than the first one. When I first got a transplant, I was nervous about pain.
Yeah.
And now I'm not so worried about that.
We'll follow you for the next year, and I think we're going to be good to go with this procedure. So
during recovery, you'll be instructed on how to carefully wash the hair at first, which medications to take, and how to care for the graft sites until you can shower and return to your regular routine after 2 weeks. You guys are awesome.
Okay, thank you so much.
Thank you. Sorry for the bros. The recovery process involves essentially no pain. I had this procedure just a few hours ago and I can't feel any pain right now. So this is what the hair looks like right after surgery. Tomorrow I'll be taking off the bandages, giving it a little rinse, and then I'll show you what it looks like on the back. It's day 2, so it's time to take off the bandages. When I got my first hair transplant, I took the bandage off first thing in the morning and it came right off. This time I waited all day and I think it dried a little bit, so now it hurts to pull it off. So I'm actually gonna go get in the bathtub and see if I can soak it off. Don't wait all day to take your bandage off. I think it just came off. I successfully got the rest of the bandage off in the bath, and this is what the extraction site on the back of my head looks like now. Good morning. It's day 3. You can't even tell that I had a procedure. Oh wow, it's barely bleeding at all. It's day 5. I just took a bath and I feel great. The hair's already growing back, and when this is fully healed, you won't notice any scarring at all. It's day 6. I'm amazed at how easy the recovery is after this surgery. It's day 7. The hardest thing right now is to not pick all of the little scabs that are forming on the back of my head. And I know it's so gross, but it's so satisfying to pick them off. It's day 8, so it's been over a week. Here's how it's looking today. It's day 9. After my first surgery, there was noticeable difference after 6 months, and then there was insane difference after 1 year. Today's day 11. I feel like a lot of healing has occurred since yesterday. The back is healing up really fast now, and you can see even though they took a lot of hair out of the donor site, a total of 2,500 grafts now, there's still plenty of hair there to cover up the donor area. In the next couple days, I think the rest of these grafts are just gonna fall out. 14-day mark, I'm gonna take a shower and lightly rub the rest of those scabs away. I made it to day 12. I thought that if I got a hair transplant, I would be dealing with a bloody, scabby mess for months afterwards. I thought I wouldn't be able to go outside. I thought I wouldn't be able to go to the gym. It's not true. I've been going on walks every morning before the sun comes up with my dog, and today I even started a light workout again. You can't even tell I've had a hair transplant. This was 12 days ago. Tonight I have an improv showcase in Salt Lake City. I was hesitant to go to it because I felt like I was still gonna be healing, but at day 12, I'm actually seeing incredible results already. There's no pinkness, red, or swelling at all on the top where the grafts were put in, and the back of my head is pretty much completely healed, as you can see. It's amazing that you can have a surgery like this and you can feel like you're almost completely recovered after the 10-day mark.
So this looks really good. There aren't really any scabs here, and you're right, a lot of the grafts have not shed.
Yeah.
And a lot of them actually started to grow already. So that's always a really good sign when I see that. So yeah, everything looks great. There's minimal erythema or redness, no sign of infection. So everything looks as it should.
Matt, hey, how's it going?
How are you?
Good.
It's good to see you.
You too.
How's everything going so far?
I'm really good.
Yeah.
It's starting to fill in, especially in the last month. I was actually at the gym today, and I just like noticed in the mirror, I was like, I have a full head of hair.
Yeah,
So
you
I was
do,
like,
and you did
it's
it
crazy.
before.
I did
So-
not.
And your hairline looks very natural.
I was kind of having a moment where I was remembering when I was 24, 25, and that's when I first started noticing my hair was thinning. And it was seriously so stressful.
Yeah.
And I understand, like, I've met people that were like, well, when my hair was thinning, I just wanted to shave my head, and they pull it off or whatever, or they're comfortable with that look. My dad is completely bald, and my brother started going bald when he was 25, is a huge insecurity of his, and so I kind of watched him go through that pain, and he's always wearing like hats and bandanas, and I don't wear hats, so I'm like, oh my gosh, this just sucks.
Yeah.
Like for years to wake up every day and be like, oh my gosh, it's thinner than it was last week.
Yeah.
It's just like the worst. And so then to have this moment is just really cool. I don't ever want to take this for granted. I like have hair again.
That
It's
makes
just
me
awesome.
so happy. It really does. It's very gratifying. Thanks, sir.
Yeah, thank you so much. Appreciate it. Subscribe to see the outcome of my second transplant over the next year as I share my recovery process and the results of my procedure.